Thank you, Alexis, for that informative presentation and for helping us get started. Now we'll introduce our panelists for this discussion. As a reminder, full bios for all of our speakers are located in Whova if you would like to learn more about them. First, I would like to introduce Dr. Kathryn Bowen, who is a retired pediatrician and chair of the Pima County Child Fatality Review Program. Next is Tatjana Loncar, who is a health educator with South Phoenix Healthy Start. Amelia Garcia, who is a doula and also with South Phoenix Healthy Start. Kathleen H, who is a caseworker with Coconino County Health Start Program. And Yomaira Castillo, who is the Injury Prevention Program Manager with the Arizona Department of Health Services. Good morning and welcome. We are thrilled to have you as a panel of diverse and multidisciplinary individuals that provide services that impact women and families all over Arizona. Thank you to each of you for being a part of this event. I have a set of questions that I will be asking the panel. We will also welcome questions from the audience, but we'll hold on to those for the end of the session. Feel free to place them into the Q&A section on Zoom at any point. And to our panelists, after hearing the questions, please take time to answer the question while still allowing for other panelists to respond as well. Let's go ahead and get started. The first question is for our direct service providers, Tatjana, Kathleen, and Amelia. And Kathleen, we will go ahead and get started with you. Question is, what can you share about how you work with parents, caregivers, to help them find some calm and comfort in the safe sleep process?
With the caseload that I take care of under the healthcare or Health Start program, would be in our culture would be the cradle board, the traditional cradle board. And a lot of our young Native mothers they'll utilize the traditional cradle boards. So utilizing it right and explaining to them the meaning of continuing to use the traditional cradle board.
Great, thank you. Tatjana, how about yourself?
So as a health educator within our program, we really ensure that we are discussing, along with the safe sleep practices, other topics such as normal sleep patterns, growth spurts, tummy time, crying, and bonding and attachment. We also utilize evidence-based strategies, data, and best practices. Along with that, we really want to ensure that within our classes, we offer time for peers to share their own stories and experiences. And we find that when we can create a space that is safe and comfortable, families tend to be able to adopt these strategies a lot more easier.
Great, thank you, Tatjana. And Amelia.
Good morning. With families, when we are working with the families in the community, they are first unaware of the SIDS epidemic that's going on. So we like to educate them about that and how it's important to sleep with their child in a crib and have a safe place for them to sleep. And if they're not able to have a safe place for their baby, then we provide them with packing plays and a safe sleep class to inform them better about the SIDS problem, the SIDS problem.
Very good. Well, thank you. Sounds like each of you are in a distinct way focusing on safe sleep using the ABCs while still trying to help parents understand that process. And sometimes it is difficult to help find that balance. The next question that I'd like for us to speak to is still for our direct service providers, and it is in consideration of cultural traditions. So the question is, we know that meeting families where they are includes understanding and being aware of cultural traditions and practices for each family. What experience can you share with us that includes cultural adaptations while still implementing the ABCs of safe sleep? And Tatjana, we'll go ahead and start with you, please. Thank you.
So a lot of the times as a facilitator, again, I have encountered families who have certain sleep practices or beliefs. And even though that is culturally passed down, we find that through conversation, we're able to discuss new strategies, and families seem to be willing to make those changes. So what we also have created within our program is a safe sleep family planning form. And this is something that our case managers and our doulas can work together with individual families, and we ask them in regard to their cultural practices, and together we ask them what adaptations they can make for their family. So we work together as a team with the family to make those changes.
Awesome. Thank you. Amelia?
Yes, some of the things that we also go over when they're doing safe sleep, if they co-sleep with their babies, then we ask that somebody come in and check on them and make sure that everything is okay and that the bed is completely clear of any pillows or teddy bears or anything like that. We also know that there's times where they're not going to be able to sleep alone. So we like to, like Tatjana said, implement the plan to have different family and support come in and help make sure that babies are sleeping on their back with nothing around them.
Excellent. Yeah, so using that family structure to be able to support them. Thank you. Yes, Kathleen?
As a educator, working with my families and incorporating the ABC of safe sleep, and again, utilizing their cradle board is something that I respect into the tradition, and incorporating the safe sleep technique is making sure that the baby is, on their back and swaddled. And in our tradition, the baby is not to be put in another room alone, and the baby is to be by mom as much as possible. So within respecting the teachings around that, just making sure that they, again, having nothing around the baby while they place their baby in the crib within the same room. If they have somebody else in the home, and if the mom has to tend to something else, to have somebody else with the baby at all times.
Great, thank you. So I think as a follow-up to that question, I know that oftentimes we're not fully aware of all of the different areas. So if each of you guys could share the service area and kind of the communities that you serve, that would be really helpful, just so that way our audience can understand the service area. So Tatjana?
Yes. So our program is infant mortality reduction program. And so we are definitely focusing within African American communities. We also work with Hispanic or Latino populations as well.
Great. And is that primarily in Maricopa County or in other counties?
Yes, Maricopa County, primarily also in South Phoenix.
Great, thank you. Amelia?
Yes, our program serves over 30 different zip codes, which do include some of Mesa, some of Glendale. In order to get a list of that, you could visit our website, but we are all around Phoenix, but primarily in South Phoenix, but we do service 30 different zip codes in the Phoenix area.
Great, thank you. And Kathleen, how about your service area?
My service area is, majority of my caseload is on the northern part of the Navajo reservation.
Great, thank you. I appreciate that. And then the next question for our direct service providers is, if you guys could please share a valuable learning experience that you've had working with families or community partners to achieve consistent safe practices. So if you could just tell us a little bit about what you've learned and some of those techniques that you use and that help you when you're out there in the field. So Amelia, we'll get started with you today.
Okay. I can share an experience I had with one of our participants who was in Estrella jail, and she got out and she was staying with some family on a couch. So she had nowhere to put her baby safely. And we have the Safe Sleep program. So we were able to train her on the importance of safe sleep, because they don't even have an understanding that the problem exists. So we train them, we give them a class, and then after, we were able to provide a pack and play for a baby to have her own place to sleep in the house that she was staying.
That's great. Yeah, I mean, definitely those would be a big learning curve in that situation. So thanks for sharing that. Tatjana?
Thank you. So what we have discovered that it is so imperative to offer coordinated and consistent safe sleep messaging throughout the course of the participants' time in the program. So from the moment that they are enrolled, we have our case managers providing education around safe sleep. We also ask these questions numerous times throughout the program in our assessments. And also we have our doulas. Prenatally, we have included safe sleep messaging within our childbirth class. We also offer infant massage class where those messages are heard as well. We have our postpartum doulas that we offer, and postpartum doulas as well share those messages and offer supports. And we have our men's program that is so imperative as well. So we're also sharing these messages with the fathers of our families and during our safe sleep class. So I think that it's really addressing the barriers that those specific families have, providing recommendations and resources, and again, that wraparound services.
Great, thank you. And Kathleen?
The way we address our education about safe sleep is prenatally providing a lot of information. And right now, you know, with the pandemic, everything being virtual, sending information through email, through text, and also collaborating with other programs within the office, like injury prevention, and also providers, you know, and providing them with pamphlets, postnatal education when they're still in the hospital, and then after they come home, and just reminding them, and then having them send pictures of their baby sleep area and continuous education for the first 3 months. And if needed, provide them with a pack and play.
Great, yes, thank you. I think it's really important to know how to access those resources if families do not have a safe sleep, crib or bassinet. So I'm glad to hear that you're connecting families to the resource and to the classes associated with that. Thank you so much. I'm going to move us into our next set of questions that are going to be directed to Dr. Bowen and Yomi Castillo. And the questions that we have for you are: if parents are struggling with implementing safe sleep habits or just worried about their baby's sleep in general, where do you send families to get help, advice, and support? And Dr. Bowen, we'll start with you, and then Yomi.
Well, that's a very good question. I'm so happy to hear of these 3 programs that are so intensively talking to families. I think that there is not enough resources available for families, and we would love to see more available. I think a place to start in teaching is prenatally. If the obstetricians or the paraprofessionals that work with obstetricians will start teaching, and many do already, of course, the hospital-sponsored prenatal classes taught by pediatricians or family practitioners. If they are addressing this issue, that's a good place to begin as well. I think it's very important that we, as healthcare providers, that we introduce the topic as early as possible in the nursery, if that's the first time you've met the family, and at every well child check subsequently. That's very important. In terms of who we send them to, I think home visiting programs are really vital and not as available as we would like them to be. I think partnering with them is a very important aspect of this. I think that it's just important that everybody, every professional, whether it's a child care provider, whether it's a healthcare provider, whether it's a home visitor, is providing a consistent message and a repeated message about safe sleep.
Great. Thank you, Dr. Bowen. Yomi?
Good morning. Thank you so much for having me on the panel. So I completely agree with what Dr. Bowman has just said. If we could really start educating our families prenatally, so with the OBGYNs and before they get pregnant, we would be in a much better place. So I completely agree with that. As far as where we can send families, there's several places. There's not a really complete list as far as somebody asked that in the chat. Because it constantly changes, but the county health departments are a great place to start. Safe Kids coalitions are a great place to start. There's 5 of them around the state of Arizona. Also, the home visiting program is another place to be able to make those contacts and connections and resources, as well as a lot of tribal communities. They have their own injury prevention offices and departments. They're also another place to be able to start. You know, and I know once babies are born, a lot of hospitals are also part of it. They do the ABC cards, which are a phenomenal resource as well. It's an education that's given at the bedside. And sometimes it can get a little lost because, I mean, if you've ever had a baby, you're exhausted, right? So this is why we talk about doing it prior to delivery. So if we can have these conversations before, I think that we capture that audience before they're exhausted and tired and have gone through 24 hours of labor. And so these are just some additional resources that we can send our families to. And then the Office of Injury Prevention. I don't have any product in hand, but I know where to send you. So if you have a family that needs something, I'm definitely able to help and point you in the right direction.
Great, thank you, Yomi. We do know that, again, through our Office of Injury Prevention, does have the supports of the county health departments in our cribs, our portable pack and plays and car seats program. So absolutely is a resource through our Office of Injury Prevention and through our county health departments and programs out in the community. So thank you for that reminder. The next question, Dr. Bowen and Yomi, what strategies can help prepare providers to support learning and awareness of safe sleep practices? Yomi, we can start with you this time.
So I think something that can happen is make sure that you're up to date. Make sure that you're reading all of the documentation that's coming out. The American Academy of Pediatrics has, they're constantly putting out the messaging and keeping on board and up to date as far as what can do. And then make sure that you're following the strategies that they're recommending. So, we can't preach enough, alone on my back in a crib. 20 years ago, it was a different message, but things have changed. Science has changed, and we know this. There's great infographics that show as well that we can show our families as far as when they lay on their tummies, when they're asleep versus when they're awake, encouraging tummy time while everyone's awake. Making sure that they are in a halo sleep sack so that nothing can get over their face, definitely no pillows, blankets. So, all of the things that we keep hearing and that Alexis presented in just a little bit ago are key to the success of making sure that our babies are staying alive. And also, really explaining to the caregivers, we have them for their captive audience for just a little bit. And so as educators, we can stay on educated and keeping aware of what the latest and greatest is. I know they're mentioning about the boppies in the chat. Those are definitely, they've been recalled. You're not supposed to use them. Somebody even suggested giving them to an animal shelter for maybe a pet bed. That would be great. But definitely, if you see them in a home and you're talking with the families, making sure that you're staying up to date on what's kind of happening.
Great, thank you. Dr. Bowen?
So I think I want to stress 2 things. One is, as Yomi said, the need for ongoing education. The committee that I lead is the Child Fatality Prevention Committee for the Arizona AAP. And one of the things that we've worked on most over the last couple of years has been an online e-learning program that right now is directed towards pediatricians. It's not a difficult program, and we hope to be able to extend it to other providers. There's some financial things that have to be worked out in order to do that. But keep your eyes open, because hopefully that e-learning module will become available soon for free. Also, one of the things that I think is very important is that every hospital and birthing facility have a safe sleep policy, that there's yearly at least training in it, that there's a quality improvement program associated with it to monitor it and make sure that the policy is being followed. I think that we don't appreciate always the importance of the modeling that we do, that when we place the baby consistently on their back to sleep in the bassinet in the nursery, when we take anything that's been put in the crib out of the crib in the nursery, that parents catch on to these things, that more than what we are saying, we are also acting on those things. So I think ongoing training, I would refer, for RNs, there's a course on the National Institute of Child Health and Development website. There's an online learning course that's very detailed and I think very good about, I think it's labeled for SIDS prevention, but it's applicable to all SIDS. And the American Academy of Pediatrics has a free course, again, a little detailed, but a free course that you can purchase through shopaap.org for childcare providers about safe sleep issues. So I would encourage consulting those websites, but also personal ongoing learning, and then the importance of hospital policy and ongoing quality improvement programs.
Great. Yes, thank you so much for that information, and for those additional resources. I think Yomi and I will definitely also take note of those. I think it's really important that we're aware as well through our programs what is available as far as training and professional development. So thank you for mentioning that. So the question that I have next is going to be, it's open to all panel members, and so really would like for us to take a little bit of time to share with the group just what are some myths around safe sleep that you have come across, or that you may have come across when working with families or providers, and how did you address them? So how did you coach them through them? How did you help move them into the direction of safe sleep, or point them in the right direction for training or other resources? So Tatjana, I'll start with you.
All right. Well, I've definitely heard quite a few from families, but one that I hear most often is from moms wanting to sleep with their baby in order to bond. And so one way that we have addressed this is where we talk about how bonding and attachment happens when both mom and the baby are awake, when they're playing, talking, looking at each other. So we offer infant massage as well. We talk about tummy time, child developmental milestones. So again, I just think that it's about teaching and a different messaging. And so a lot of the times they're willing to take those into consideration.
Great, thank you. Kathleen?
I don't know if it would be a myth or a taboo, but again, like letting your baby sleep away from you, not right beside you in our tradition, and explaining to them that that you can still practice safe sleep by having baby right next to you in the cradle board, when you use the cradle board, and that's on their back and they're swaddled, and making sure that you rotate their head. And also another thing in our belief, that if you are to leave baby in a room by themselves, making sure there's a fire poker right by them. So I think that would be more of a taboo than a myth. I'm not too sure.
Sure. Yeah, thanks for sharing those. Yeah, because the distinction matters, and I appreciate those examples. How about Amelia?
One of the myths that I have come across is that sometimes families think that if they lay baby on their back, they're going to choke on something or that they'll not breathe that way. So we explain that laying them on their belly, it's probably more likely to happen because they'll suffocate themselves. So I always like to encourage just laying baby on their back, again, with no pillows and no teddy bears or anything around them to give them that opportunity.
Yeah, good point. Sometimes I think as parents, we don't necessarily always think of the anatomy of the body and how it actually works. And some of those pieces of information can definitely help to solve and clarify some of that misinformation or myth. So thank you. Yomi.
So again, kind of what Amelia and everyone else has said is, you hear all these different things, but there is a really great picture. And I think that we may even have it that we can share. I might have sent it to Clark. We can post it about the human anatomy and how versus when they lay on their tummy, when they're asleep, and then on their back, kind of how just the human anatomy works and the chances of them actually asphyxiating on their own selves. So that's probably one that I've heard because they think it's safer because their mouth is down, but it doesn't work that way. And then also about bonding, I think Tatjana hit it really good. When you're asleep, nobody's really bonding. You have to be awake for that to happen. So just making sure that they have their own safe sleep environment next to you. You can room share, just don't bed share. And really talking about the risk and the protective factors is why we're encouraging and why we want to do that, so that everyone stays safe. Because if you're tired, and we know this, if you're tired, nobody's going to really get a good night's sleep. And it's something that they learn. It's not something that they come out of utero saying, oh, I'm going to sleep on my back all of a sudden. It takes a long time. And just when you think you've nailed it, things are going to change, because that's what babies do. It's child development. So, this is a learning and process. And if they came with a manual, things would be so much simpler, but they don't. So just making sure that we're all, staying educated and explaining that to that tired mom who's probably in that process at that time. Oh, here's a picture I think Clark is sharing with you. So this is a good one to be able to see just kind of how the human anatomy works. But Dr. Bowman's the doctor, so I'm going to let her really explain that a little bit better, or you can just see it kind of how it works.
Thanks, Yomi. And Dr. Bowen, any myths or that you've come across when working with families or providers, and how did you address them?
So I think you've covered most of the myths. The one about choking. Another factoid that's kind of helpful for me to think about is that there has been no increase in the amount of aspiration pneumonia or aspiration related deaths since the institution of back to sleep in 1994. So I think that's good evidence that putting a baby to sleep on their back does not result in more choking on things that they've thrown up. Another myth or concern that I've run across is that babies seem to be more comfortable sleeping on their stomach. And part of that is that babies have a natural startle reaction. It's maybe more prominent when they're on their backs. It's completely natural. It is not a sign of pain or discomfort. It's just something that happens. We as adults do it too. We just don't pay any attention to it. As Yomi said, babies need to learn to sleep on their back. And the way they learn is to be consistent, that every single time they go to sleep, that they are put on their back. And that they can be equally comfortable on their back as on their stomach. One that we haven't talked about too much is that the fear that babies are going to be too cold when they're sleeping. Overheating is a risk factor for SUID as opposed to being too cold. If the parent is comfortable in the room with the amount of clothing that they have on, the baby should be comfortable in that room as well. So dressing the baby in the number of layers that you would want to be dressed in that particular room is the appropriate approach to how much covering a baby needs during sleep. And then the last one that you've all alluded to is this concern that parental vigilance by having the baby sleep in the bed with them will prevent SUIDs. And in fact, that's not true. There isn't a parent on earth that can be vigilant enough to protect every baby. Sometimes horrible, tragic things just happen. But having the baby in the room for at least the first 6 months with the parents, and ideally up to the first year, it does decrease the incidence of SIDS. But having the baby sleep on a separate surface from the parent seems to be much more protective. So at this time, we have to recommend that baby sleep on a separate surface right next to the parent, but on a separate surface from the parent.
Thank you so much to everyone for your insight and for the information that you've shared. I do have one last question. I know it will be just a little bit different than what we had sent out, but I think just any final words of encouragement or advice before we move on to the audience questions. So I'll really open up to anyone who would like to go first, and any final words, encouragement or advice for those with us today in the aspect of safe sleep or how to work with families around this very crucial topic and sensitive topic.
I can go.
Thanks,
Some of
Amelia.
the things that I tell my families, especially if they have other children with them, I include the other children in the conversation and say, like, look, baby's sleeping, your little brother's sleeping, let's not put the stuffed animal by him. Or if you see something in there, then you can take it out and make sure, you know, like, come in and check on baby as well, and make it a whole family thing, especially when they have younger children involved. And even the teenagers, teaching them before they have children, like, this is what's happening to our babies, so we need to watch out for each other in that way and make it a whole community collective with the family.
Yeah, I love that. Thank you, Amelia. Anyone else? Any advice, words of encouragement?
I'll just say again.
Parenting is hard.
Yeah.
Oh.
Go ahead, Dr. Bowman.
Just parenting is hard. We appreciate that. Parenting is exhausting. They're all tired, and I appreciate that. We want to make this as simple as possible, but back in my ancient life, I was a pediatric ER doctor. I remember vividly one week that I was working nights, that every morning for the week, for probably 3 or 4 days in a row, between 5 and 7 in the morning, I had a baby brought in who was found while sleeping to no longer be breathing, and they all passed away, of course. That was a long time ago. Things have changed. There are a few simple things that we want parents to do consistently to prevent those kinds of tragedies. The ABCs are a really good mnemonic to remember. If you do those 3 simple things, you're probably hitting most of the important aspects.
Thank you. Yomi?
Just to add on what Dr. Bowman said, parenting is hard, and it's not, like I said, it's not something that babies come out knowing how to do. They have to learn how to sleep on their back. It's not something that comes natural, and Dr. Bowman covered it really well. And so just keep the encouragement, keep reminding your families that parenting is not an easy task, and just when they nail something, then something else new is going to happen. And so it's a constant change, probably until they're 5 years old. So just encouraging them to do the right thing. And you know, the ABCs is, when we chose that, it was something that was easy. It was something that could be remembered just alone on their back and in a crib. So I think that's one of the things that we just need to keep reminding our parents, and hopefully one day we will have any SUID deaths in Arizona. Wouldn't that be nice?
Yeah, thanks, Yomi.
And I would just like to add how important it is not to use the scare tactics because sometimes that can happen when it comes to safe sleep practices. And really talking with family, like I said earlier, creating that safe space where families can talk with one another and share experiences and stories, include fathers, include grandmothers, like Amelia said, other siblings as well, is another part of that.
Great, thanks.
Just to touch base on this subject, in a lot of Native families, not only is there a household of one, but usually there's multiple generations, like the mother and the grandmother. So just educating everybody in the household about the ABC and how it can be incorporated into the tradition as well.
Great. Well, thank you so much to each of our panelists for sharing how you support families in achieving safe sleep, and for sharing, your personal experiences in working with families as well as your professional experiences. The work that you do providing counsel to parents and caregivers, also to providers and community partners about safe sleep practices for their baby. It matters, and as you all know from the data, is definitely a very important topic to continue to address. So your participation in this panel has helped provide more understanding about strategies to improve safe sleep practices. So thank you so much. And now we're going to take some questions from the audience. So I am going to take a look at our list of questions. We will do our best to get to all of the questions, but if we do not, we will try to address them at a later time after the summit. So first question is, how do you educate and help families from very low socioeconomic backgrounds living in a small space and cannot afford to buy a crib for the baby? And if we could have we'll start with our direct service providers, one of your comments first, and then Yomi, I'll have you follow up.
So what we do is we actually partnered with Phoenix Children's Hospital. So they're the ones providing training for us and pack and place. So we're able to provide that. It is not easy at times, but we do talk with the families about the barriers in having the baby next to their bed. And pack and plays are a little bit smaller, also faith-based. A lot of the times there's cribs or pack and play that they're able to obtain through some faith-based organizations as well.
Great. Kathleen or Amelia, any additions to that?
I would have to say the same thing. I have a great collaboration with the injury prevention educator in the office, and we talk about how we can educate the family and how we can provide like a pack and play in a very small space if needed.
Yes, thank you.
Yes, sometimes I've come across families who I can see they have a very tight space and no crib, and they're embarrassed to ask for it. They don't even know how to ask for it. So we offer the services like, oh, if you don't have this available, we have the classes to teach you, and we have a pack and play to give to you. And so then do that, teach them and give them a pack and play, because sometimes it is a lot of their pride. They don't know how to ask for help. So to be there to offer it when you see it in the home, you just have to be vigilant and be able to offer that service to them.
Thank you. And Yomi, any final thoughts on that question?
Yeah, so we, as funding is permitted, then we provide pack and place to a lot of our community partners. And so that earlier I mentioned the county health department is a great place to start, because a lot of them do have them, and they have the injury prevention programs. So I think that's what a lot of the ladies here have been mentioning, is that you can definitely start with that. Pack and plays are a little bit smaller. They're able to fit in smaller spaces, and they're great because they can go on the go with you. So it's the consistency, right? We talk about consistency and doing the same thing. So, and babies are very used to certain smells. And so if that's going to help them safe sleep, then, it has the bassinet on the top and then for the bottom. And so that's probably what I would recommend is that definitely get in contact with those and find something. And if you can't find it, let me know, and I can definitely direct you in the right direction to find you if your family is looking for one. But we work with all the home visiting programs. We work with the county health departments, the Safe Kids coalitions, tribal communities. So somewhere in your area, there's some pack and plays, and I can direct you to that. It's not necessarily just in the Phoenix area. I want to make sure that we're addressing those for all of rural Arizona as well.
Yeah, and Yomi, do we have a list anywhere that is able to, that's on our website or that we can make available or to kind of share, or would they have to call you directly?
I've never put one together. I have a list that when I'm placing an order that I can direct you. We've never put it on a website. We've never done any of that. People have asked for that, and sometimes they change. And so I would just be really cautious to send that out. But I think that if it's the same county health departments that are ordering, we could probably work with them to make sure that we put something together and we can send it out to our resources. The other ones I would be a little bit more, just a little worried because things change, and
yeah,
updating things isn't always as easy as it sounds.
Yeah, no, definitely. All right. Well, thank you for that. And I just wanted to make sure that we covered that. So next question is, how can somebody request pack and plays for families?
So again, the county health departments in your area would be a good start. Some hospitals also have them. And so I would definitely check with them. And then if you are an agency that's looking for some, so the only thing that we have ever asked is that education have to be a component, very similar to the way the car seat programs have been run in Arizona. Is you have to have a course, you have to show the family how to put it together, and they have to be able to take up and put down. So assemble, I guess, is the word I'm looking for. So making sure that they're able to do that, and then talk about the risk and protective factors. And so we have some presentations, some canned presentations that we can kind of help you put together if you don't have that. And then we can definitely supply you with some. Storage is always an issue. So I would just be cautious as far as when you decide, or if you're looking at implementing the program within your agency, that you take that into account. But definitely let me know, or talk to your home visitors, talk to anyone within your area to see kind of how they are doing it. And we can build from there. This is for all of Arizona. We've never just kept it within the Phoenix area. There's Coconino, there's Navajo, there's Apache. I work with Yuma, I work with Pima, Santa Cruz, you name it, I'm everywhere. So, just definitely let me know, and we can kind of figure that out if you're looking for something.
Great. I'm going to ask the question that came in for Dr. Bowen, since it seems like a question she could answer quickly. Dr. Bowen, you mentioned 2 training programs you liked for hospital providers. One was from AAP, but was wondering if you could mention the other.
So the program I mentioned was a online module, fairly extensive module for RNs. And that's provided through the National Institute of Child Health and Development. I can't remember the exact title of it, but it mentions SIDS in the title. It's probably would take you 3 or 4 days. It's a fairly sophisticated training module, but the National Institute of Child Health and Development is a branch of the National Institute of Health. So I believe the website is nichd.nih.gov. And if you put their program, their overall sleep safety program is called Safe to Sleep.
Safe to Sleep. Okay. Thank you.
And the other program that I mentioned is not for healthcare providers. It's for daycare, childcare providers.
Great.
Probably more directed towards supervisors, or not all workers, but for the it's more of a train the trainer kind of course. And that's the one that's available through the American Academy of Pediatrics for free.
Awesome. Okay. Thank you for clarifying. All right, I will take us back to some of the safe sleep messaging questions. So next question here will go to our direct service providers and or anyone else that would like to jump in. But the question is, how would one balance safe sleep messaging with the biological norms of babies to want to be near their mothers? Many parents feel that they have no choice but to hold their babies all night.
So something that we have to kind of consistently keep in mind as a trainer is that, again, as when we are teaching about safe sleep practices, is more to it than that. We understand that. So we definitely are talking to them in regard to normal sleep patterns, crying, self-soothing, bonding, and attachment. And of course, we always have to mention that it's not easy. We understand that babies do want to be with us. So we do talk about skin to skin and white noise and using other things around the room to create a little bit more of a comforting space for the baby and to be consistent. We always say, you know, if we can have the baby sleep on their own and using comfort techniques to soothe themselves, then you're really preventing some habits later on. So skin to skin is really important. We do want to ensure that families know that if the baby is crying, there is a need. And so we always right away encourage them to pick up the baby right away to assess the need, but not to create certain habits that they're going to want to break later on.
Great. Yeah, I imagine each family, you know, and parent has a different need, right, to kind of address that information. So I think that having a more holistic approach to discussing sleep patterns and other resources or techniques is also key in helping them to achieve safe sleep when we're talking about safe sleep through the evening. Anyone else have anything that they'd like to share on that specific question? Any other advice for parents that feel like they have no choice other than to hold their babies?
Utilizing the family spirit curriculum, and it teaches the parents early on about routines, sleep patterns, and with the family spirit, it's also geared more toward the native population, which is awesome. And it helps the family to prepare for those kind of situations. And with many people, generations living in the household, as the family takes turns, so they develop a schedule on how to care for the baby.
Thank you. All right. So next question. Many families think that it is okay to have unsafe sleep practices if they are watching them, especially at nap time. The messaging needs to be out there that it is never okay as a separate bullet point. Has this been a topic of discussion? So I guess how would you, what recommendations would you have for our audience in regards to nap times and parents and caregivers thinking it's okay to practice different safe sleep habits, nap time versus evening, nighttime?
There is some evidence that exists that a baby who normally sleeps on their back, if they're placed on their stomach to sleep, has actually a higher rate of SUIDs than if they slept consistently on their stomach. So one of the important messages is that they are put back to sleep for every sleep.
Great, thank you. All right. The next question is, what about tummy time and how can new parents incorporate this into their safe sleep routine? Let's see, any, Tatjana?
Tummy time is actually on the list of safe sleep practices from the AAP. So whenever the baby is awake and there is supervision, we certainly encourage tummy time.
Great, thank you.
In our program, we also provide that tummy time as a class and as an activity for families as well. So we're able to show them how they can do tummy time with a very young newborn on their chest, or different techniques of rolling up a towel, putting it and lifting the baby up, getting down on the floor with the baby. So we are incorporating different ways because, you know, a lot of the times family will say, my baby doesn't like tummy time. And so we are showing them different techniques that they can utilize, whether it is culturally appropriate, maybe a mirror or toys that make noise or that have lights to engage the baby, or during diaper times, they can do tummy time as well. So we use different techniques.
I really like, Tatjana, what you said earlier about how babies bond with their parent when they're awake, and that tummy time is a great time to do that. I really appreciated you saying that.
Thank you. The next question we have is a question that's come in regards to a specific practice. It says, at WIC, we discuss SUIDs before birth and during. Should we be discussing at older times when the infant is older? So how long should that discussion be occurring when you're working with families about the risks of SUID? Dr. Bowen, do you want to get us started on that one?
For pediatricians, I would recommend that they talk about it at every well-child check, at least through 6 months. As you probably all know, the peak age for SUIDs is between 2 and 4 months. It does occur beyond 6 months, but after 6 months of age, the incidence drops off dramatically. So at least through 6 months of age, I would continue providing the safe sleep message.
Great. And how about to our direct service providers? How often are you guys having this discussion through your home visiting programs or through the programs that you offer? Amelia, go ahead.
I mention it at every visit all the time. If there's a baby involved, if there's kids involved, if there's teenagers involved, we talk about it. We talk about safe sleep, what's happening, why it's happening, and how we can prevent it. Like, it doesn't matter what age the babies are.
Great. And Tatjana?
Yes, so the families that we serve are until their child is 18 months old. And every 6 months, we do certain assessments that this is asked for. Of course, case managers ask at every single visit, at least for the first year. And so we are definitely keeping the safe sleep practices a consistent messaging throughout the program time.
Great, thank you. All right, I'm just going through really great questions. So let's see. Do you know of any ABC safe sleep education materials that is available in the local tribal language or integrates the tribal cultural stories or practices that align with safe sleep guidelines? That's a great question. Does anyone have any information about that?
On the, I always get this acronym wrong and I need to memorize it. On the Eunice Shriver website where she has the Safe Sleep campaign, there's a lot of different posters that have different ethnicities and that are culturally appropriate that you can find, and they're free. And gosh darn it, I'll have to find it and maybe have Clark send it out because I just don't remember what it's called, but I know that there's different ones and they show different images. So there's ones that are for tribal communities, there's some for Hispanic communities, and they're in those languages. It's just getting them secured that you can find them on there. And I don't remember, I'm sorry, I'm very bad with acronyms. I always have to look them up, but they are available on there.
So the
yeah,
Eunice Shriver is
yep.
the same website that I've been mentioning, the National Institute of Child Health and Development.
Yeah,
there was a program developed called the Healthy Native Babies Program, and I think it's still, I'm sure it's still online because that's where I found it. It's getting a little old. It was developed after a study that was done among the Northern Plains Indian tribes. And this was a teaching module that they put together. There's a poster. It's, I think it probably needs a little modification at this point, but that is available through that same National Institute of Child Health and Development website. It's in English, of course.
And Kathleen, do you guys have any materials that have been translated?
I refer to the same one that Yomi mentioned.
Great. Awesome. Thank you. And then let's see. Does anyone on our panel, the question here is, at what age is it okay to let a child sleep with a stuffed animal or a blanket? Yomi, do we have anything on that? Trying to think.
So the one thing that we do advise parents is if they're going to have a blanket in the crib with an infant being on their back, nothing else in the crib, we say the blankets should be at their kind of armpit or lower level and then tucked in around the pack and play to their sides. And so another thing we really say is if they really believe the infant is cold, maybe putting little mittens or little socks on their hands, and having like a onesie or sleep sack. So that's another thing that we promote is the sleep sack versus having the blanket. And stuffed animals, we can play with those all day long during our tummy time, during our play times, during bath times. We can play with other toys. There's lots of opportunity to play with toys. So definitely there's not a need for that. One thing we do say that mom can actually sleep with the child's onesie or the sleep sack so that the baby then can be dressed within the outfit or the sleep sack that will have the mother's scent. So that could be a little bit more of a comfort for the baby as well.
Exactly what Tatjana just said. We want to tuck the blanket up, up to their chest, nothing above. And this is for obviously the younger ones. I'm not sure if the question was trying to address as they get older, when that would be. I'm going to tell you a year. Looking at the data is anything after a year. 6 months, we know up to 6 months is when most SUID cases happen. But let's be consistent. If we can say up to a year, after a year, then they're coming into their own. They're able to, if developmentally, every child is going to be different, obviously, but they are able to push away, or they're more probably rolling over more. They're flipping from their back to the front and kind of going that way, however they feel comfortable. But definitely not anything sooner is what I would say. And you're making sure the sleep sacks, encourage them to use them. I know I'm just going to say in the Hispanic community, we dress them up to bundle. I mean, it is 100 degrees outside and we have them in socks in the San Marcos blanket. Everyone knows who that is. And it's just not practical and it's not safe. Overheating is one of the risks. So making sure that we're addressing those issues culturally as well, I think it is really key.
Yeah, and good question. I think overall, I mean, we do know that the evidence shows us that the ABCs is obviously the best way for us to kind of navigate that conversation. I think that the age in particular was where that question was going, and I think that for right now, the information that was offered, if we're able to find any additional information. Dr. Bowen, have you read any research or have had any experience in anything that addresses a specific age? I know that I have not, so just want to make sure.
I have not seen a specific age. I agree with Yomi and the others that if you're talking about a comfort object, usually those kids are older, so well over a year. But for the younger babies, absolutely not.
Great. Yeah, thank you for clarifying. All right. And then let's see. Does the mattress thickness play a part in safe sleep? For instance, a crib mattress compared to a pack and play? Yomi, do we have anything, or Dr. Bowen, any?
The thing that's always said is a firm mattress. So it isn't so much the thickness, it's that you don't want a water bed or something like that that has too much give where the baby's nose can become entrapped. So it's more the quality of the mattress than the thickness.
Great, thank you. And let's see. It's kind of hard. So this question is asking how they can get the resource, I think, of the pack and plays in their county. So Yomi, if you could address that, that would be really great. I'm not sure which county. Oh, I'm sorry, Greenlee.
So Grand Greeley is, we typically do together, but I do send some there. I'll have to find the contact. If you would put your contact information in the chat or maybe flag it, there's so many in here. I can find out where that is and I can direct you. There's, well, lots. So if you could put that in there at the very bottom, I'll write it down right now and I'll get back to you on that one. Because there are, I mean, we go, they're everywhere. And it's just depending upon the time of year that I'm ordering, if they could take some or not. And this one of the last orders that I did, a lot of the county health departments, they basically said, Yomi, we had to give up our space for the PPE equipment that we needed for COVID. So, I mean, it was just kind of the reality in it, but I have you, Annette. So I will write your email down and I will get back to you on when the last order I placed there and who it went to. And we can go from there because I know I have sent some there before.
Thanks, Yomi.
Okay.
Let's move on to some questions that have come in for Alexis regarding data. The first question that came in, Alexis, was what are the SUID accident deaths?
SUID accidental deaths would that like I mentioned before, it's 64%, and so most in the last 5 years have been indicated as accidental. So an example, this is not like any particular, but an example of that might happen was the baby was found maybe with those boppy pit. Like I know in the comments there, I don't have a kid, so I don't even know what those are called. The bobbies, yeah, I learned recently about those. So if the baby was found there and the investigation team did determine that the nose got into the pin, they would view that as an accident because of course the parents didn't mean to do it, but it wasn't a natural death. So it wasn't like the kid was diagnosed with the syndrome that's associated with SIDS. So that would be an accident. Another accident might be that, oh, this is a very common one. And maybe the panelists this would bring up more conversation in chat. If a baby falls asleep while breastfeeding, that's a very common thing that we also hear in investigations. So the mom didn't mean, maybe the mom does practice wholeheartedly safe sleep practices, but she's accidentally fell asleep on the kid. Another one, unfortunately, there's a lot of kids in the bed and one of the kids rolls over on the baby and suffocates it. So of course it's 64%. I could go through all kinds of examples, but I'm sure you guys are starting to get a picture of what it might look like to have an accident related to a SUID. So hopefully that answers the question.
Thank you, Alexis. And the next question, Alexis, is does the data on smoking statistics include vaping?
The information is taken off of the birth certificate, and I do believe that when they do the birth certificate, they're talking nicotine-based smoking. That's what I think. So I don't think it includes vaping that I'm aware of, but okay. Yeah, that's what I think.
All right. And then the last question, Alexis, is there available data of the age of the babies with sleep that are associated with sleep-related deaths?
So there would be, I saw that chat I think it's by Shelley. I did see that and I was like, I don't know why I didn't think about that because the information is there. So there absolutely is. It probably would just follow other research that reveals that. I think Dr. Bowman said it was 3 to 6 months that, or less than 6 months is where most suicides happen. So I'm sure it would follow those national trends over the last decades, but I could have absolutely done that. I was like, why didn't I do ages?
That's okay. Well, great. We had a question come in and you were able to include it. So thank you so much, Alexis, and thank you to our audience member for that question so we could clarify. I am going to ask one more question of the panel and then we will wrap up the session. The question that I can, let's see, respecting safe sleep practice with highest SIDS reported occurring between 2 to 4 months and up to 6 months. Has there been any consideration in looking at any influence from stressing the immune system during this time? So I'm not sure if there's any information from our panelists around how maybe the immune system or looking at that type of information ties into safe sleep.
So many people have pursued many potential causes for SIDS primarily. And the difference between SUIDS and SIDS is that SIDS is a diagnosis after you've done a thorough investigation and you can't find another cause. So that's the difference between SUIDS and SIDS. People have looked at any number of factors. I know when I was a resident, we had this sort of auxiliary faculty member who was looking at the role of some heavy metal in SIDS deaths. So people have looked at everything. Currently, the biggest theory is that babies who succumb to SUIDS don't arouse as easily to the stimuli of decreased oxygen or increased CO2 in their or carbon dioxide in their environment. But that still remains a theory because there's no absolute proof for that.
Thank you so much for the question and thank you, Dr. Bowen, for the response. All righty, well, I am going to wrap up this session. Thank you so much for all of the questions that came in from our audience. For those questions that we were not able to get to, we will definitely take a look at them and provide an opportunity to respond. So I will once again say thank you to our panelists. Thank you for sharing your experiences with us, for sharing your advice, your recommendations, and your expertise, and most importantly for the work that you do around improving safe sleep practices and working with families both culturally within traditions and preserving those traditions in order for families to be able to both practice them, but also more than ever take a look at safe sleep practices through the lens of cultural practices and just how we keep babies safe. So thank you so much for that. And to close out the session, I wanted to quickly share a slide that includes the 15 evidence-based safe sleep recommendations from the American Academy of Pediatrics. And these are the foundation to all of our programming focused on keeping infants safe. Thank you for that slide. The article describing these recommendations is available on Whova under the Safe Sleep session on the agenda. Thank you, Dr. Bowen, for making sure that we had that information available. And once again, quickly to share the ABCs of safe sleep. The baby should be sleeping alone on their back and in a crib, bassinet, or portable crib with a firm mattress, nothing else. And with that, really quickly wanted Yomi to just share a few words on a safe sleep campaign that ADHS is currently working on. And so real quick, Yomi, could you just share a little bit of insight about the upcoming Safe Sleep Media campaign?
Yeah, so we're very excited. We are just finalizing everything. So we, over the last couple of weeks, have been filming a commercial and getting different actors and babies to be able to be a part of it. So it will be for the Arizona Department of Health Services, in conjunction with Strong Families, so the home visiting program, we have a commercial where we showcase a father about putting his baby to sleep. So being inclusive of male roles and dads, and also about a grandmother and then a mom, and they're going to both, it's going to be in English and Spanish. So we're really excited. We have, it's going to hopefully launch digitally. I can't see the word.
Digitally, you're good, you're good. You did
Yes,
lots of
there you
talking
go.
today.
Thank you. So it's going to launch. There's going to be we're going to put it on Instagram. We're going to put it on Facebook. You're going to see it. So hopefully, as your families are starting to Google, and if any new families are coming up and are looking for that, it's going to be one of the things that will be popping up really soon. The babies were fantastic. We got all of them to sleep during the appropriate times. You're going to see them alone on their back in a crib. And so we're just really excited. And the fact that we had some, a dad was a part of it. And he was African-American, was super cool, and the baby. So it's going to be definitely different ethnicities and showcasing that, because we wanted to make sure we were inclusive of what our state looks like. So it's really exciting. And so we're really looking forward to it. So stay tuned, because it should be coming out very shortly.
Great. Thank you so much, Yomi. And thank you again to each of our panelists for your time this morning, for taking all the questions and for those really important questions that we heard today. Remember that the safe sleep related resources are available on Whova. And now we're going to be taking a short break. When we return, we will move into our last set of presentations before lunch, and of course, end the day with the March of Dimes, moving beyond labels training. So thank you so much, and we will see you back here at 10:45. Thank you.